Thank you, Senator Seward. I will read mine due to my cognitive impact of Lyme and also an incredible sense of care to Australian Lyme patients. So all doctors have a spectrum of views from our perspective, and some which are led by scientific skepticism and precaution or risk, and some are driven by their in-depth clinician experience. Underpinning the current challenges is policymakers and desk doctors writing policy, standards, and guidelines for the frontline doctors who actually have extensive clinical experience. The big issue is uncertainty. Without doubt, there is significant clinical and scientific uncertainty. That is accepted for almost all diseases, but in almost all other situations, the foundational standards embrace permission for clinical decisions based on the medical opinions and the experience of the treating doctor. What is not helpful and is actually harming sick Australians is the absolute and inflexible certainty doctors have about the no Lyme here stance. It is dangerous, it does not align with clinical practice, and it denies over 20 years of extensive epidemiological evidence. In an honest and authentic medical system, good doctors on the front line of emerging diseases would be calling the alarm. Medical colleagues, scientists, and policymakers would be rushing in partnership to stem the flow of illness, disability, and death, thus minimizing harm while progressing knowledge. The truth is with Lyme is the absolute opposite. Granted, complex diseases like Lyme and associated diseases have extraordinary levels of uncertainty in the testing, the diagnosis, and the treatment. What we're seeing in Australia is that it is easier to adopt the dogma, a position of inflexible certainty, than to have to think harder, do the right thing, and adopt international experience and precedents. Australia should be treating patients with the best of the knowledge of the day while rapidly advancing local science and clinical measurements. Further compounding blocks of progress for Lyme patients in Australia is the continual publication of low-value evidence being published in medical journals, combined with the willful exclusion of supportive evidence, allowing skeptical doctors, health policymakers, and regulatory bodies a justifiable and defensive position to deny patient treatment while vilifying and punishing their doctors. We are witnessing health policy being deliberately weaponized against clinical responsiveness and innovation. Right now in Australia, both patients and their doctors experience what could and should be called medical gaslighting, where groupthink dominates and neither facts or science matter. In tick seasons, doctors have been flagged by Medicare for ordering too many tick-borne disease blood tests, which is their job. APRA and governing bodies become judge, jury, and executioner without demonstrating any proof of harm to patients and with no recourse for the doctors. I'd like to quote from page 2 of the Marcus Blackburn submission. In the balance of competing interests, action should be weighted in the favor of public safety. Furthermore, with said uncertainty, to progress and finalize a clinical pathway that has A, been categorically rejected by patients, Lyme knowledgeable doctor stakeholders, and Department of Health consultants, Dr. Horowitz and Dr. Schwartzbach. B, underinformed by a distinct 30-year gap of direct focus on Lyme disease, and C, very limited research only just commenced with an expected 5 years to outcomes. We assert that the pathway repressing medical help is negligent and inappropriate. In 2016, I remember an MP at the House of Reps roundtable into Lyme disease, slamming his hand on the table in absolute outrage at the rhetoric he was hearing from the Office of Health Protection representatives. He said, we should have learned this with HIV and AIDS and Helicobacter, but here we are repeating the same mistakes. So what we're seeing now in 2021 is doctors continuing to behave badly and citizens of Australia suffering and dying because of it. It must be repeated that these doctors are not guilty of harming the public, but of thinking differently, guilty of being progressive and refusing to squish a square peg into a round hole, or in many cases, operate outside of their moral compass. At the LDAA, we continue to receive 60 to 80 emails per month from Australians seeking a doctor to evaluate where Lyme and associated diseases could be part of what's making them sick. A rough estimate would indicate that 20 to 25% of those have recent bites that they link to that illness. There is no epidemiological study or surveillance in Australia. Dogs and cattle possibly, but humans, no. Internationally, the incidence of Lyme disease is on the rise, with the US recently updating its surveillance figures to 476,000 annually. We tracked 39 other countries, which indicate a mean global prevalence of 5.8%. So obviously, it's absolutely implausible that Australia would be the only continent on the planet without this disease. Applying this prevalence rate to us would see Australia boasting 500,000 cases in the past 20 years of denial. And that's equating to nearly 24,000 cases annually. That's 20 times more than HIV, AIDS, and MS combined. For example, since 2018, due to the decreasing numbers of doctors accepting Lyme patients, we've had to recommend that patients include overseas treatment as part of their treatment pathway decision making. As of this year, we now have only 2 states where doctors have books open to Lyme patients. It's truly like a battlefield. Our organization and every single patient, we're in a war zone, and it's both heartbreaking and soul destroying. I have to do so much mental health support for our volunteers. I was interviewed by John Laws this week because a listener had called in the day before. At the end of 20 minutes, he asked me what his listeners should do if they wanted help for a tick bite. I had to pause and say, I don't really know. Maybe you should be calling and consulting your MP and senators. These reckless actions are violating the fundamental human rights of Australian patients and their doctors, and something needs to be done. Thank you for the opportunity.